Speaking about stress, that's one of those things where I feel has not been, at least to my knowledge, maybe you can correct me, studied. Because for some reason, I think a lot of people have seen this just in their practice. For example, my patients that are not trying to get pregnant, the chance of an oopsies or hey, who, whatever, their stress is really low. They just don't even try, they get pregnant fine. For some reason, I find a lot of my patients who are the most on it, the most wanting and willing to try to get pregnant, they tend to have a little more time. And it's kind of like this weird dichotomy that for some reason, maybe this is just what I've seen in my practice, but I have a lot of other people tell me the same thing, where a patient who comes in, they're ready to start a family, they all their ducks in a row. For some reason, that person on average has a harder time than some person that just got drunk, gone out and had sex and magically got pregnant. Is there any literature on stress and getting pregnant?
Yes, absolutely. I caution with this, right? When someone's stressed and and they're struggling with infertility, and then you go to them and say, "Stop stressing out. It's causing
Mhm.
your infertility." Now they're stressed about the fact that they're stressing. I always tell patients it is a factor, it's not the factor, right? There's typically multiple causes. What does stress do? So stress does affect how your brain and you communicate, right? So your brain is sending signals LH and FSH, I call them egg food essentially, that tell the ovary to, hey, make me some eggs. And then as the eggs grow, it sends a signal back to the brain called estrogen that basically says to the brain, thank you for the food, I got enough food. And that conversation typically goes back and forth until one egg is large enough and is released through the process of ovulation. It actually can affect that signaling. So there's something called GnRH, which is essentially from the hypothalamus, goes to the pituitary. You remember all this stuff from med school, maybe. But the signaling that happens, stress does interfere with it. Now, another question I get a lot is, does it cause miscarriages? And just to point out that chronic stress, not necessarily, but significant acute stress, there have been studies that show can be associated with it. But yeah, it plays a role. It's not the role. If there's something we can do to help reduce it, going to a place like here, we try to reduce that process. There's definitely a benefit to it.
Yeah, and kind of going back into that, I never tell someone that's stressed to stop stressing. That's just like I'm thinking about my wife when we had our first kid. One of the things that would piss her off the most is sleep when the baby sleeps, sleep when the baby sleeps. It's impossible. There's so many things going around. And even worse, I'll tell you a self-deprecating story. Okay, let me caveat this. I'm a lot better with my patients than my wife, I think, as we all are, is when we were going through our fertility journey for that reason, we had some issues up front, and then she her lining wouldn't grow. She had something. I think there was a stress component to there, and I told her stop thinking about it. She wanted to start doing the surgery. So for people that don't know, BRCA is a breast cancer gene associated with a bunch of other genes. But typically, one of the things you can do to reduce your risk of breast cancer is to do a mastectomy, which is like the removal of the breast. So this shows you, I promise I'm better with my patients. My wife was freaking out. She's like, I'm like, you know what? Schedule your surgery. And she's like, it's not going to happen. I'm like, good, schedule it. Watch, you'll see you'll get pregnant beforehand. So she had her surgery scheduled for a Monday, the Friday before, positive pregnancy test spontaneously. That's how we have my daughter. So how much? I don't know. Again, this is an N of one study,
Right.
but I really think there's something to it. And
Yes. So the answer is that there is. It's just putting too much pressure on yourself to reduce your stress. So, for example, what are some of the things I tell patients to do? Things that they enjoy. If working out is enjoyable, work out. If getting a massage is enjoyable, get a massage. If acupuncture, if you like it, do it. If you don't like it, don't do it because you're adding stress. Right? Doesn't make any sense. If you do, it can be pretty powerful. So the other thing I'll talk to patients about is they'll want to know early pregnancy, right after an embryo transfer, what are some things you can do? And I say the same thing. Don't do things that are majorly stressful. Like if you like your in laws, hang out with them. It's really stressful. Maybe don't. Those are some of the things. The same thing with travel. For some people, even though travel can be stressful, they love it, they enjoy it. And it's not an anxiety producing or provoking event. So go for it. So those are some of the different things. Everyone has the other thing that I think is so important and I think is often forgotten is therapy. It is so helpful to have a therapist. Now, some patients will have therapists, but who aren't familiar with fertility. There are fertility therapists. We actually work with one called the Kaya Collective. which is one that I've worked with for a couple of years, and they're fertility therapists, meaning these are people that understand exactly what you're going through. They know what each visit means. They know what the value of the visit is. They know what the numbers mean. They know what the different treatments are. And that can be incredibly valuable and beneficial to a patient to have that. So I do encourage patients as well, even if you have your own therapist, they'll work together with you. A good fertility therapist will work together. It's well worth the time. I think therapy is great for everyone, but specifically in this case, having someone who has some expertise in the area can also be extremely beneficial.
Definitely. And on my end, something that happens a lot, they'll have patients, they'll be like, we've tried for 3 months and I haven't gotten pregnant yet. And I'm like, I explain to them that it's normal. If you're over 35, 6 months, under a year. But something I have done a lot of times is the ones that really push for a workup. I will start them, and if they want a consult, I send them for a consult. And I found for some reason there's something where they give that, like they take the pressure on them and they put it on someone else. How many times have someone gone to your office, they opened the door and they had a positive pregnancy test?
So it's funny you say that. So one of the things I actually say to patients, and I think it's so important, is towards the end of the consult, I say, okay, it is now my responsibility to figure out how to get you pregnant. It's no longer yours. I believe that actually helps people get pregnant because I do have a significant number. And this is why I tell patients when they come see me, even if, so if you've been trying for a year, by the time you come see me, your chance of getting pregnant each month is maybe a couple points, a couple percentage points. 80, 80 something percent of patients, typically about 85% of patients will have conceived by year one, something like 93% over the following year. So your chance per month is relatively low, but it's still there. And I still tell patients, keep trying. And there's a good number of patients that call me up a few weeks later and are like, Dr. Bartos, I don't have to come in for whatever the test was that they were supposed to come in for because I'm pregnant. I'm like, awesome. I count that as a win. Come in, we're going to confirm the pregnancy. We'll do an ultrasound. We'll do everything. I count that as a win because, again, when you walk in my office, my goal is how to build your family. Sometimes that's through getting pregnant. Sometimes it can be other things. It could be through surrogacy. It could be through adoption. It could be through egg donation. There's lots of different ways to build your family, but that's my goal. My goal is to help build your family. Whether it's something I do, whether it's simply because you saw me and now you walked away feeling like it's no longer my job to figure this out, but I got an expert who's going to do it for me. Either way, it's a win.